One of the unexpected side effects of the COVID-19 pandemic for many has been weight gain. All of that time inside with limited exercise and snacks at your fingertips may be taking its toll. It's being called the quarantine 15. And for people who struggle with their weight or have diabetes or a heart condition, potential weight gain can lead to other health problems. Dr. John Romanelli, the medical director of Baystate Health's General Surgery and Bariatric Surgery, discussed the issue with Carolee McGrath.
Certainly, without much physical activity, we're all at risk of weight gain as we get older. Many people are using the term the quarantine 15 or the pandemic 15 or the COVID 15. I like to point out there's a dash in there, and the dash stands for minus. It should be the quarantine minus 15, right? We should use time away from work to try to lose weight and get healthier.
We should, but it's really hard, I would say, especially when you have everybody at home. I think the other problem that people are facing is this, boredom. You get through with so much work or so much schoolwork, and then it's raining outside, and the pantry's right there. I think that's a big problem.
Absolutely true. And I think making good food choices when you are going to the pantry, have an apple, don't have a processed sweet. Making better food choices when you're at home is the key to warding off the unnecessary calories that are so tempting.
Tell me a little bit about your role as the head of bariatric surgery at Baystate. Obviously, sometimes people will say flippantly, "Oh, I'm going to gain weight, during this quarantine," but it's a real serious issue, especially, for people who have struggled with their weight through the years.
Yeah, and the scary thing is that it certainly seems that obese people are far worse when they get COVID-19. So an important message to viewers is this is an example of why being overweight is not healthy for you. We've seen it in the American experience with COVID-19 that the patients that did the worst, they actually weren't the elderly necessarily, they were the overweight older people. So we worry about morbidly obese people because they're more susceptible to many different diseases. Overweight people are more likely to be diabetic. They're more likely to have high blood pressure. They're more likely to have things like sleep apnea and high lipids in the blood and high cholesterol in the blood. Almost every body system is affected by being overweight. So to go back to your original question about what's my role as the director of bariatric surgery, I do operations for people designed to make them lose weight. And this is for people that are about 100 pounds over their ideal body weight. But the idea is not to make them thinner or skinnier. It's to make the high blood pressure go away and the diabetes go away and the liver problems and kidney problems all improve. It's to make people healthier, not thinner.
But tell me a little bit about that. Obviously, it's sort of an unexpected, maybe not for a doctor, an unexpected fallout, but I think for many, Americans, here's another fallout of this period of isolation. When you're talking about people who are obese, the CDC's numbers, I think from 2017 to 2018, said that 42% of adults are considered obese. It's a big problem.
Yeah, the numbers are staggering. We are getting heavier as a society. That is absolutely true. And I think the message here is that you have some control over this. We have to get moving as a society. And I understand with social distancing and with isolation and stay-at-home measures, if you're someone that goes to the gym regularly and the gym is closed, a big tool was taken away from you. I understand that. But it is safe to go outside and get fresh air. And whether that's going for a walk, whether that's going for a run, whether that's riding a bicycle, I personally go cycling on the bike trail in Westfield and Southwick, and there are dozens of people out there getting exercise. So, and they're all staying 6 feet away from one another, and many are wearing face masks, but people are getting exercise and staying safe. They're not mutually exclusive. So get moving, folks.
How do you help people who are emotional eaters? Because, it's easy to say, skip the potato chips, but when it's a rainy day, and you're feeling a little bit blue because you can't see family members or whatever, it's really hard to break that. What are some practical strategies, in addition to going outside and getting exercise, to kind of break through that cycle?
So I really didn't like the term social distancing. So Social distancing implies you can't see or talk to anyone or be in communication with anyone. My children FaceTime with their grandparents every Sunday, both sets of grandparents, just so my parents and my wife's parents can see their grandchildren. They can't be in the same room with them and they live in different states, but they see them every week. So we're not socially distanced. We're staying as connected as ever. So what I would tell people is stay connected with your loved ones, stay connected with your friends. You don't have to be in their presence to be connected. So we should be using the technological tools we now have to stay connected. I mean, think about if this pandemic hit 30 years ago, what would we have done? We didn't have cell phones, we didn't have laptop computers, we didn't have communication platforms like we're using now. We have more tools than ever to stay connected, and it doesn't mean we need to be within 6 feet of one another.
How would you advise children during all of this as well? Because when you go to school, there's that certain routine, and you have snack time maybe at 10, and you have lunch at 12. And how do you help parents keep their kids on track if they're struggling to keep on track?
It's an absolutely fair question, and with families that have two working parents, it's really hard to pull off. But what I would tell parents is try to keep your kids on a schedule similar to their school schedule. So that means don't do the schoolwork at 8 o'clock at night. Do it at 10 in the morning when they'd be doing it at school. Feed them at the time they'd normally be in the cafeteria, although I would argue sometimes that's a little early in the day, but try to do their meals around when they normally would eat. Try to do the activities that they do virtually. My boys both are martial artists, and they do online karate classes at the regular time they'd be having them. So we try to keep our kids on as normal a schedule as can be in this abnormal time that we're in. And that sense of structure gives them comfort.
So you obviously work with many, many different people. You've done surgeries on many people. What if somebody has backtracked during this time? Maybe you had a bad day and they had been trying to do well and eat well. What would you advise them?
That it's completely normal. So this is a tremendously stressful time. So healthy ways of relieving stress are important. Good communication with family and friends is important. Reaching out to your healthcare providers. An important message I want your viewers to hear is that it is completely safe to come to the hospital. Don't stay at home if you have a medical problem that needs urgent attention, because when you do come in, it might not be a fixable problem. You're not likely to get COVID-19 by coming to the hospital. We have those patients in Springfield in their own isolated wards. If you need to have emergent medical care, seek it, please, because if it's too late, we can't help you. And to your question, for those that have problems with, say, depression or anxiety and see mental health providers, they're still there for you. And use your resources. If you need help, get help. It's available.